Good morning, everyone. So today we'll see about the joints of the pelvis from the anatomy. So the joints present in the pelvis are lumbosacral joints, sacrococcygeal joint, intercoccygeal joints, sacroiliac joints, and the last one is pubic symphysis. So first we'll see about the sacroiliac joint. So the primary function of sacroiliac joint is to transmit the whole body weight from the vertebral column to the bony pelvis. So the type of the joint is synovial joint. Variety is plain variety. Articular ends are auricular surfaces of both sacrum as well as the ilium. So the sacral auricular surfaces is covered by the fibrocartilage. So the ligaments present in the sacroiliac joints are capsule, interosseous sacroiliac ligament, anterior sacroiliac ligament, posterior sacroiliac ligament, as well as the accessory ligaments, which includes the sacrotuberous ligament and the sacrospinous ligament. So we'll see about one by one. First one is the capsule. It's a fibrous sac which is attached to the margins of the articular surfaces. So the interosseous sacroiliac ligament, it's a very strong ligament that suspends between the two iliac bones, and it is attaches to the outer surface of the sacrum to the inner surface of the ilium, and it is covered posteriorly by the dorsal sacroiliac ligament. And the next one is anterior sacroiliac ligament, which is thick anterior and inferior parts of the capsule. Posterior sacroiliac ligament, which lies over the interosseous sacroiliac ligament, and it also stretches between the intermediate and lateral crest to the posterior superior iliac spine. Finally, the accessory ligaments. So the flat triangular ligament is known as sacrotuberous ligament, and the thin triangular ligament is known as sacrospinous ligaments. So next we'll see about the relations of these sacroiliac joint. So anteriorly has major iliacus, iliolumbar vessels, and obturator nerve in the abdominal surface, and piriformis lumbosacral trunk, internal iliac vessels in the pelvic surface. So the posterior aspect, erector spinae muscles, gluteus maximus, and the sacrotuberous ligaments are present. So the blood supply to this joint is iliolumbar artery, lateral sacral artery, as well as the superior gluteal artery. And the nerve supply for this joint is superior gluteal nerve, first and second sacral nerves. So the movements present in these sacroiliac joints. There's a slight anterior-posterior rotatory movements which occurs during flexion and extension of the trunk. So the applied anatomy is subluxation of sacroiliac joint due to strain on the ligaments, which may persist even after pregnancy. So next important joint is pubic symphysis. The type of the joint is secondary cartilaginous joint, which is a symphysial joint. So the articular ends are symphysial surfaces of both body of pubis covered with the hyaline articular cartilage. So the ligaments present in the pubic symphysis. First one is superior pubic ligament. Second one is inferior pubic ligament, and third one is anterior pubic ligament, interpubic disc. So the first one, superior ligament, which extends between the pubic tubercles and connects the pubic bones superiorly. Inferior pubic ligament connects the lower borders of the symphysial surface of pubic bones, which is stronger than the superior ligament. And the next one is anterior pubic ligament, which covers the joint anteriorly. Interpubic disc, fibrocartilaginous disc between the symphysial surface of body of pubis. So the functions of this pubic symphysis. So the slight movement at the pubic symphysis occurs during pregnancy. The movements increases at the pubic symphysis. And the next one is lumbosacral joint. So the lumbosacral joint, the type and articular surfaces, which are median lumbosacral joint and lateral lumbosacral joint. So the median lumbosacral joint is a symphysial joint which includes the intervertebral disc, and lateral lumbosacral joints between the articular facets. So the inferior articular facet of L5 articulates with the superior articular processes of S1 sacral vertebra. So the ligaments present in this joint. First one is iliolumbar ligament, and the second one is lateral lumbosacral ligament. So the iliolumbar ligament extends from apex of transverse process of L5 to inner lip of iliac crest, And the lateral lumbosacral ligament extends from lower margin of transverse process of L5 to the ala of sacrum. So the nerve supply is L5 and S1 spinal nerves. Movements here are flexion, extension, and lateral flexion. So clinical anatomy. First one is lumbosacral angle. Second one is sacralization. Is nothing but the fusion of L5 vertebra to the S1. Third one is lumbarization of S1 vertebra. It gets separated from the sacrum. And the last one is spondylolis. This is which is anterior slipping of L5 vertebra. So the last one, fourth one is intercoccygeal joints. It is present only in young children and it is a superficial type of joint. So this fusion begins at the age of 20 and it gets completed by 30 years. So it's absent in the adults. And the last one is sacrococcygeal joint. It is a joint between the apex of sacrum and base of the coccyx. So the type is secondary cartilaginous joint, symphysis. Articular surfaces are apex of sacrum and base of the coccyx along with the fibrocartilaginous articular disc. So the ligaments here are anterior sacrococcygeal ligament, posterior sacrococcygeal ligament, which contains superficial and deep fibers. And the third one is lateral sacrococcygeal ligament, and the last one is intercorneal ligament. So the nerve supply S4 to S5, spinal nerves and the coccygeal nerves. The movements here in these joints are slight flexion and extension during defecation as well as labor. So these are all about the joints of the pelvis. Thank you.